In the same way the human body requires food, hydration, and oxygen, it also requires sleep. Even among healthy people, the amount and quality of sleep influences health and quality of life because sleep helps regulate physiological functions. Thus, occupational therapy practitioners should consider routinely screening for factors affecting their client's sleep. By addressing such factors, as well as related routines and habits, practitioners can enhance the effectiveness of rehabilitation, promote health and well being, and increase engagement and life quality. Practitioners should acknowledge the importance of sleep in practice, and the study of sleep should be prioritized by researchers in the field to meet client needs and establish evidence for interventions. Sleep influences mood, behaviors, and energy levels as it is vital to participation. Sleep is a state of altered consciousness during which the body rests and restores itself. Because sleep is an occupational domain that plays a critical role in health and well being, occupational therapy practitioners should consider sleep with clients throughout the lifespan. This article describes the importance of sleep as an occupation and proposes recommendations for increasing occupational therapy's role in addressing this domain, especially with populations with neurological impairment. Improving sleep offers a strategy to prevent physical and psychological comorbidities, reduce healthcare costs, and increase clients' life quality and satisfaction. Adolf Meyer was the first in the occupational therapy field to recognize the vital role of sleep. In Philosophy of Occupational Therapy, he proposed that rest and sleep were necessary and of equal importance to work and play in maintaining health and well-being. The American Occupational Therapy Association originally classified sleep as an activity of daily living. In 2008, rest and sleep were reclassified as an occupational domain in the Occupational Therapy Practice Framework domain and process. This shift in focus acknowledged the significant effect rest and sleep can have on participation. Poor sleep is the most frequent complaint after pain in people with chronic illness. The Centers for Disease Control and Prevention has recognized insufficient sleep as a public health epidemic. It is estimated that 50 to 70 million US adults have a sleep or wakefulness disorder, such as sleep apnea, pain syndromes, parasomnias, and insomnia. Sleep helps regulate the body's physiological functioning and substantially affects health, participation, and engagement. Therefore, it is not surprising that sleep can influence employment status, social interactions, and daily functional in general. When sleep is insufficient, brain functions, mood, and healing processes often are compromised, and deficits in attention and working memory result. Inadequate sleep has been linked to heart disease, stroke, cancer, depression, diabetes, and obesity, as well as increased risk for mortality. Occupational therapy practitioners are well positioned to understand how illness, the environment, habits, routines, and psychosocial factors affect sleep, yet sleep is under-recognized by many practitioners. Current research and reports focus primarily on sleep in children with developmental disorders and older adults. In adults with neurological impairment, the impact sleep may have on rehabilitation processes, therapeutic outcomes, activities of daily living, and meaningful occupation is less frequently addressed. Among populations with neurological impairment, such as people with spinal cord injury, traumatic brain injury, stroke, multiple sclerosis, Parkinson's disease, and dementia, sleeping difficulty and daytime sleepiness are common. A person with spinal cord injury participating in one of our recent research studies indicated that sleep and fatigue were the main factors influencing her participation in meaningful activities. She reported that her rehabilitation progress depended on the amount of sleep and rest she experienced. Unfortunately, this person's sleep-related problems, like those of many others with neurological impairment, remained undiagnosed and untreated. Sleeping difficulties in the population of persons with neurological impairment are often viewed as secondary problems with poorly understood etiologies and limited treatments. Although health professionals may consider poor sleep to be a secondary concern, it likely exacerbates the impairments from primary diagnosis and plays a critical role in daily functioning. Diagnosis of sleep-related conditions is not within occupational therapy scope of practice, but our profession is in a position to assess sleep and its impact on participation and satisfaction. Sleep-related assessments. No known standardized occupational therapy assessments are specific to sleep. Tools that do exist include qualitative assessments that can be used to identify the client's impression of sleep quality, sleep habits and routines, number and type of disruptions, and participation. The Functional Outcomes of Sleep Questionnaire examines the repercussions of daytime sleepiness on instrumental activities of daily living, and sleep diaries, logs, and interviews provide insight into sleep patterns. Such assessments may be useful in identifying sleep-related problems and establishing intervention approaches. However, because these assessments are not standardized, they do not allow practitioners to quantify either the degree of sleeping difficulty and sleep quality or the changes that may occur in sleep behavior. Standardized sleep instruments used in other disciplines can be adopted until instruments specific to occupational therapy practice are developed. The Daily Cognitive Communication and Sleep Profile provides information on sleep disturbances related to cognition, communication, and mood. We also have the questionnaires, such as the Fatigue Severity Scale and the Pittsburgh Sleep Quality Index. They both can quantify sleepiness, fatigue, and sleep quality. Actigraphy measures the number and duration of nighttime disturbances. Once a sleeping difficulty has been identified using one of these assessments, it is appropriate to consider therapeutic approaches. The development of assessments that could measure the functional impact of sleep on life participation and daily activities, however, would aid occupational therapy practitioners in targeting therapeutic approaches and documenting associated outcomes. One intervention used in occupational therapy to address the consequences of poor sleep in people with neurological impairment is energy conservation. Pacing strategies, rest breaks, and schedules based on peak energy levels have been reported to be beneficial for people with multiple sclerosis and Parkinson's disease. Although this strategy may be beneficial for severe fatigue, it does not directly address the occupation of sleep. Instead, it is a compensatory technique that limits life participation. In an effort to improve sleep and enhance engagement, occupational therapy practitioners should consider other interventions for clients with neurological impairment. Common interventions for people with primary sleep disorders include cognitive behavioral therapy, physical activity interventions, multi-component interventions, and modification of the sleep environment. These interventions may improve sleep across neurological populations and can be incorporated into occupational therapy practice. CBT can promote awareness of factors influencing sleep, such as stress, pain, diet, apnea, and they can teach methods to manage or modify these factors. Moreover, goals and schedules promoting physical activity and exercise can be developed in collaboration with the client. Multi-component interventions combining multiple sleep intervention strategies such as CBT and physical activity may also be used. Other strategies range from providing adaptive equipment to modifying the environment. For example, sleep apnea may be reduced with sleep positioning alone or in combination with use of a continuous positive airway pressure device. A quiet and dark sleep environment using earplugs and a sleep mask may offer a strategy to improve sleep in people with traumatic brain injury or post-traumatic stress disorder. Minimal clinical effort is required to integrate and incorporate assessments and interventions, such as those outlined in this section. We propose that sleep should be routinely assessed with standardized measures, addressed with intervention, and reassessed as part of standard practice for clients with neurological impairment. I propose the following recommendations to advance occupational therapy's role in sleep. First, knowledge and skills related to sleep should be integrated into educational curricula. Learning objectives should incorporate an understanding of sleep as an occupational domain that affects health, well-being, and participation, the assessments that are currently available, the evidence base surrounding different interventions, and the need to develop standardized sleep assessments and interventions specific to our field. The same objectives should be presented at professional development events to increase knowledge and application to practice. In addition to educating those within our profession, we must also advocate for awareness outside of occupational therapy. We should strive to make other health disciplines aware of the consequences of inadequate sleep and occupational therapy's role. Occupational therapy practitioners can work toward this goal through education and networking with other health professionals. Occupational therapy practitioners practice a holistic approach and should work toward understanding all aspects of a client's diagnosis and care. We should not hesitate to initiate dialogue with other members of the client's healthcare team, promoting interdisciplinary relations and providing a platform to discuss sleep with other disciplines. It will be critical to expand the evidence base for existing occupational therapy interventions and focus efforts on identifying novel ways to improve sleep and reduce fatigue. We should investigate the effect of sleep on activities of daily living, engagement, and participation. My closing thoughts are that the influence sleep has on general health and well-being necessitates addressing it in client populations throughout the lifespan. Occupational therapy practitioners and their clinics and departments can take a variety of steps to enhance awareness of the importance of sleep and incorporate sleep-related considerations into practice. As we move forward, it will be important to prioritize research efforts targeting sleep assessments that meet our clinical needs, and to establish an evidence base for treatment interventions aimed at fostering the rehabilitation process, enhancing participation, and improving life quality and satisfaction for our clients.